Hello, everyone. Welcome to the second episode of Mental Health and Makeup. My name is Jasmine Young, and I am a psychiatric and mental health nurse practitioner. And I'm about to do my makeup for the day and talk about mental health. So, welcome. Today, we're talking about anxiety. Okay. All right. There are a lot of different anxiety disorders. Okay, and we're going to talk about panic disorder and generalized anxiety disorder. We're also going to talk about OCD today. Okay. All right. So first, I just want to say many people have anxiety, and anxiety is not necessarily pathological. Anxiety can be good anxiety. It can be the type of anxiety that keeps you on your toes. You know, the type of anxiety that helps us to be better at whatever we're doing. You know, but anxiety becomes pathological when it starts to interfere with your daily life and you cannot function because of anxiety. Okay, and anxiety, if left untreated, it could get worse and worse, and you could actually have panic attacks. Or panic disorder, okay? And that is when you totally lose control and definitely would need to be medicated if you cannot tolerate that type of anxiety, okay? So let's talk about it. Have you ever had a panic attack before? I have. Anyone who knows me knows I suffer from anxiety. I'm able to control it now, but 20 years ago I was not. And so I suffered from panic attacks. And after the first panic attack, it seems like your body just wants to keep going there and keep going there. So I know about this disorder personally. But who else can help you all through it than someone who's been there? All right, so panic disorder. Of course, I am using the DSM today, my favorite best friend. And this is our Diagnostic and Statistical Manual of Mental Disorders. And I'm coming off of page 208 if you want to follow along, if you have the DSM. Page 208, the diagnostic criteria for panic disorder. Okay. So the first thing it says is the diagnostic criteria, recurrent unexpected panic attacks for panic disorder, okay? A panic attack is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes, and during which time 4 or more of the following symptoms occur. Okay, so it reaches its peak and you just don't have like shaking or sweating or feelings of impending doom. You have to have a few of these, and it says 4. Okay, note the abrupt surge can occur from a calm state or an anxious state. So you could be calm just sitting here like I'm doing, or you could already be anxious, okay? And the panicky state is an abrupt surge, okay? It's not just a underlying anxiety. It's an abrupt surge, okay? So you have to have at least 4 or more of the following symptoms. All right, palpitations, pounding heart or accelerated heart rate. Have you ever had palpitations before? Palpitations feel like thump, 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 thump. It's like you can feel your heartbeat jumping out of your chest. As we're sitting here, I'm not feeling my heart beating. Are you? Or is it just beating fast because I'm here? I'm a hoot. Some people say I'm really funny, guys. You can laugh along. All right, but palpitations. Palpitations are when you can actually feel your heart beating in your chest, and it doesn't feel good. It's more like a skipping beat, an extra beat, and you'll notice it. You definitely will notice it. Sweating. Are you sweating now? There's many people sweating out there. It's kind of hot in Atlanta today. Are y'all sweating? Trembling or shaking. We all know what that is. Sensations of shortness of breath or smothering. And some people have told me that, Jasmine, man, you know, when I get up in front of my company, or when I get up in front of my friends, or when I'm at work and my coworkers or my boss, man, I feel like I'm short of breath. I feel like I'm smothering. When I get up to talk, I feel like I'm smothered. I can't talk, shortness of breath. And some people will hyperventilate during a panic attack. Okay. Also, feelings of choking. Some people say they have like a frog in their throat. I have a frog in my throat. Ribbit, it's a frog. No, not a real frog, guys. Just a tightness in your chest. It doesn't feel good. It's not a good tightness. It's like, in your throat. It's like that. Feelings of choking. Now we're coming down to the chest. The feeling of choking here may actually go to your chest. You could have chest pain, chest discomfort, chest tightness, all that. That's not fun. It's not fun. And now we're doing 4 or more of these, okay? Nausea or abdominal distress. A lot of times that'll be the first symptom that you're having anxiety, especially in children. Children, they'll start complaining of, I have a stomach ache. My stomach hurts. I don't feel right. My stomach feels weird. My stomach hurts. I don't want to go to school. My stomach. Because when we're feeling all these different signs and symptoms, our stomach acid increases. Okay? Now, I'm not going to treat your stomach acid. If you come to me in the clinic with stomach issues, we'll say, have you had your stomach checked out? Do you have reflux? Have you had a doctor check out your stomach to see, what's going on with your stomach? And if you say no, yeah, I'll still prescribe you some medication for anxiety, but I'm going to want you to go and see your doctor regarding anxiety, okay? Feeling dizzy or lightheaded, unsteady or faint. Some people hyperventilate and they feel faint. They say, I'm going to pass out. Chills or heat sensations. Whew. Now, ladies, I'm not talking about the people that are going through menopause right now, okay? I have women telling me, oh my gosh, I'm menopausal. I'm having night sweats. And I'm like, oh, you may need to talk to your gynecologist about that, about the night sweats. Yes, I can prescribe medication, for depression that helps with night sweats. But man, make sure your hormones are right, okay? If you're having night sweats. You may not be suffering from panic disorder, if you don't have 4 or more of these symptoms. If you're just waking up at night, with sweating, then it may be hormonal. There could be other things going on. Maybe you have the heater on. Okay. Paresthesias, numbness or tingling sensations. Usually it occurs in your head or in your hands, your feet. All of a sudden your face, a part of your face may feel numb. You say, oh my goodness, why is my face going numb? Am I having a stroke? Now, some signs of strokes, you can tell, like, in the face, but we're not talking about strokes today. We're talking about anxiety, okay? So if you're having anything going on in your face and your face is tilted like that, you need to go get that checked out. Don't call me, because I'm going to say, go to your doctor and get that checked out. Go to your internist, because I'm not diagnosing you with stroke or CVA or any of the rest of that stuff, okay? We're not doing that. I'm not diagnosing you with any medical problems. All mental, okay? I'm going to refer you to your primary care. But yeah, paresthesias, numbness and tingling sensations, derealization, or feelings of unreality. Like you take a back seat to what's going on in your life. You're not an active participant any longer. You took a back seat. Derealization, things are not real. You say, was that real? What's going on? It's like you don't feel like you're participating in what's going on. Derealization, fear of losing control or going crazy. All right, guys, have you ever, and guys and gals, have you all ever felt like, man, I am going crazy? And you add that feeling with the feeling of impending doom. and you're breathing hard. And so you all can see how this disorder can really mess with your level of function at work. How can you be at work having a panic attack? You can't. And then people worry after they have their first panic attack. Man, when's the next one gonna come? All right, there are some culture-specific symptoms, okay, like headache, uncontrollable screaming or crying, tinnitus, which is ringing in the ears, and neck soreness. Such symptoms should not count as one of the 4 required symptoms. So culture-specific, you know, some people will cry and scream more than others, and that could be cultural. We want to make sure that people aren't just happy or excited. You know, we want to make sure that this is definitely involuntary and this is controlling their life and interfering with their lives. Okay. At least one of the attacks has been followed by 1 month or more of one or both of the following: persistent concern or worry about additional panic attacks or their consequences, like losing control, having a heart attack, or going crazy. Yes, once you have one panic attack, sometimes it sets you up for more panic attacks, okay? And anyone who knows me knows that I suffer from anxiety, and I've had a panic attack in the past. It was not fun. I'm going to tell you, I didn't know what was going on. You know, it was a long time ago, but I've learned how to control panic now, and that's all I want for you all. It's for y'all to learn how to control panic, that's all. I know how to control it now, but back then I didn't, 20 years ago, when I was in school at Langston University, L's up, LU. When I was at Langston, I had my first panic attack, and I thought I was just like losing it. I didn't know what was going on, and it was because someone was late to class, in our health assessment class. And we were threatened that if anyone is late, then everybody gets a 0 on your test. 0? For me? Oh, no. I can't get a 0 on a test in nursing school. They will fail you out, okay? So you all understand that it was kind of turned up a little bit. The pressure in the class, and I don't know what overtook me. You know, I had been up studying and all night, and man, I was ready for that test. And someone in not physical therapy, someone in the health administration program did not show up for class, and I just didn't know what to do. I knew we were going to get a 0 in the group, and I don't know, that derealization came in. The sweating, the shaking, the shortness of breath, smothering, feelings of choking, and I just had to leave the room. And I went down the hallway and just collapsed. I had a panic attack. Next thing you know, I was being taken to the student center, you know, for help. And that just was not fun. So besides these 4 symptoms that you're having, at least one of the attacks has been followed by 1 month of either this persistent concern or worry that you're going to have another panic attack, which is just not fun. It's not fun to think, is this going to happen to me again? That's not fun. It's not a fun thing to have. Also, a significant maladaptive change in behavior related to the attacks. So I may avoid class. Now, I don't even want to go to class anymore. And it's sad. I don't want to go to class because I feel like I may have a panic attack if I go. Like, I don't want anyone to ever feel that way. I don't want to go to class. It's keeping you from doing things in your life. You know, I don't think I want to go to class today. That same thing may happen. It's embarrassing, you know. Only the people who were in class with me know about that. Do y'all remember that? It was embarrassing, you know. So you make decisions to where you're like, man, I'm not going back there. I'm not going to do that anymore. Or maybe you just, I hope you wouldn't fall out of school, you know, drop out of school. But sometimes panic attacks and things like that, when people don't know how to deal with them, it'll stop them from going back to school, because they're embarrassed about it. The disturbance is not attributable to the physiologic effects of a substance like drug abuse. Now, if you're out there doing all those drugs, Mollies and Ollies and Roxys and Smoxies and synthetic marijuana and all these other types of drugs that are out there, yes, it can make you feel panicky. So if you're on drugs or using some type of substances and you come to the office saying that you're having a panic attack, I'm going to say, well, the drugs that you are taking or this in your system, they could be causing you to have this onset of abrupt anxiety. So first we got to get you clean from the drugs, and then we'll talk about what we can do, because you may not have a chemical imbalance of serotonin, which is theorized to be responsible for panic attacks, a decreased level of serotonin. We may not have to increase your serotonin levels. You may just need to stop taking the mollies and oxys and all the other drugs that are out there. Y'all know the drugs that are out there. All right, the disturbance is not better explained by another mental disorder. So the panic attacks don't happen like, if someone has a phobia. Say somebody's just scared of spiders. I used to be scared of spiders. I kind of still am. For people who know me, y'all know I don't like spiders. But say people have a phobia of heights, and you take them out on a balcony, or you take them on a ride like I was on the other week. Did y'all see that? There's a ride, okay? There's this ride at Busch Gardens in Tampa. Oh my goodness. Okay, we're not gonna go there. But if you're interested in hearing about the ride, just look on my page, Nioki Young. Look on my page, and yeah, you'll see the ride, and you'll see that was very, very anxiety inducing. So if you have a panic attack and you have at least 4 of these symptoms when you're 350 feet up in the air, that's a little bit different, okay? And you're turned down to see your fate. You're turned like this, and the only thing that's holding you there is a harness, and you start to freak out and panic. Yeah, that's a panic attack, but that's not a panic disorder, because you actually have a disturbance that is happening acutely. I didn't have a panic attack on that ride, but I sort of kind of died, okay? And I came back. But anyways, I digress. Okay, so also, if you have some type of obsessive compulsive disorder, that's outside of panic disorder, okay? And we'll get into OCD. A lot of people say that, oh, I had a panic attack. But if you've ever had a panic attack, you know what a panic attack is, okay? And the reason we have these panic attacks, theoretically, is because we have a low level of serotonin in our brain. And serotonin is a chemical, it's a neurotransmitter. It's responsible for signs of depression and anxiety. So all we do, if you've tried and tried and tried, and you can no longer handle this panicky feeling and you can't manage it, then we do recommend you take an SSRI at least, an antidepressant. So you say, wait a minute, an antidepressant? What am I doing with the antidepressant if I'm anxious? People say, well, why are you going to prescribe me that? An antidepressant. Well, antidepressants are the medications that increase serotonin levels. So you could call them antidepressants, or you could call them anti-anxiety medications, or we could just call them SSRIs, like they are selective serotonin reuptake inhibitors. SSRI. Okay, those aren't the only antidepressants we have, but those are what we start with. And the one I like to start with is escitalopram, if you don't have any heart problems. Escitalopram or Lexapro, Zoloft, sertraline. Or we could start with another one of my favorites, Prozac or fluoxetine. And I mean, either one of them will work really well. I like escitalopram for people who are medication naive, people who don't take a lot of medication, or maybe they've never taken a medication and they say, I don't really want to take a medication. I say, well, let's start with something like Lexapro or escitalopram, because escitalopram is our best tolerated antidepressant. You know, it usually starts working within a week. That's what the research study shows, at least. But now we do need to give all SSRIs, all those antidepressants, at least 2 to 8 weeks to work, okay? So please don't come to me a month later saying, this medicine's not working. I mean, you can come to me a month later in your follow-up, but I'm going to say, okay, let's stick with it and let's just increase the dose. Let's just increase the dose, especially if you can tolerate it, because it's, like I said, one of the best tolerated medications, Lexapro is. Okay, escitalopram. Escitalopram oxalate. It's a weird word. Escitalopram oxalate. It comes from Celexa, these isomers. And Celexa, it's a wonderful medicine. Celexa is like the daddy, and Lexapro is like the son, because Celexa has escitalopram and R-citalopram, these isomers. Well, Celexa is a very good medication, but they say, you know what? Let's see, it's very strong, you know, with the side effects and everything. Let's make it more tolerable. So let's take the R-citalopram out, and let's just leave the S-citalopram. And that's what they came up with, escitalopram. It's pretty cool, right? All right, so once you start taking something like Lexapro, you take it every day, the same time, every day, okay? You can't just pick and choose, oh, I think I'll take my antidepressant today. No, it's not gonna work like that. They don't work like that, okay? They don't work like that. You have to take them every day. And you take them the same time every day. The same way, preferably, okay? The same way, like with food or without food. And usually you want to take them around the same time within an hour, okay? Because you don't want the medication to drop in your system. You want it to be at a nice, steady level. So you take it every day, something like Lexapro, Prozac, Zoloft, and then you'll follow up with your provider in 1 month. The follow-up is 1 month, guys. 1 month. Don't come back in 2 weeks. Please don't come back in 2 weeks. You know what I'm going to tell you when you come back in 2 weeks? You haven't given the medicine time enough to work, so what are we doing? You just want to come see me? You want to come see my makeup? Because it's not going to work that fast. Yes, it will start to work within the 2 weeks, but you got to be patient. Look, y'all, it took y'all years and years and years to get like this. Whether it's 18 years, 19 years, you know, with children, their stomachs are hurt. So, you know, we just need to get them some medication. If not therapy first, if the therapy's not working, then we just need to put them on medication. But with adults, y'all have been going through this for years, you know, so please do not come to me thinking that you're going to get something that's just going to stop anxiety like that. Now, we do have medications that stop anxiety like that. They're called benzodiazepines, but those medications are not first-line treatment for anxiety. Those are second and third line treatments for anxiety. Those are not first-line treatments. And those medications, you build tolerance for over time. And also, people can get addicted to benzodiazepines. So I don't really do a lot of benzos. As far as treatment, I don't do benzos. I mean, I do have some people that are on benzodiazepines, but the thing about it is they'll either come to me having already been on a benzodiazepine, and I'll keep them on if they're elderly only, because the elderly, a lot of times, they don't really care about losing their memory. You know, of course, it's not cookie cutter. I look and make sure, you know, that the person understands that these benzodiazepines can cause memory loss and forgetfulness over time. You need your memory. I don't want to hear that. No, I don't need my memory. You need your memory. Okay? All right. We don't want you to run out of memory, okay? So, but I mean, there are times where I do prescribe benzodiazepines. They're not evil, okay, guys? Benzos are not evil. I don't want people to think, oh, you know, so-and-so is taking Xanax, so-and-so is taking Ativan, so-and-so is taking Klonopin, so-and-so is taking Valium. Those are the most popular ones, you know, the 4. And I don't want you to say or think, man, so-and-so is taking that and it really works for them. You know, why can't I take it? You know, I don't want it to have a bad rap or whatever, but benzos, guys, let's not get strung out, okay? Let's not get strung out and addicted. You know, we're already going through a lot right now. We don't need addiction to benzos as one, because if you take something like Xanax or Ativan, you're gonna like the way it feels. Of course you're gonna like the way it feels, but you can't take that stuff for a long time. You're only supposed to take that for like 2 weeks at a time. You're only supposed to take that for 2 weeks. And of course, people don't only want to take it for 2 weeks. By the time 2 weeks comes, it's probably not going to be as effective. So then a month later, you're going to say, you know, I like the way that medicine feels, but it no longer works, Jasmine. I need more of it. And I'm going to say, okay, you want more of it? You're taking it every day. You may as well be taking an SSRI, something that is going to cure anxiety and not just put a Band-Aid on it. Something like a benzodiazepine like Xanax and Ativan and Klonopin and Valium, yeah, they're going to stop anxiety, but they work on something called GABA, and GABA is inhibitory. We need something that's going to increase serotonin levels to cure anxiety. We need something that's going to increase serotonin levels. And the only thing that does that is an SSRI or SNRI, a medication with an S in it. Its classification has an S in it that stands for serotonin, okay? Benzodiazepine, does that have an S in it? No, 2 Z's, no S's. We need S's. We need S medicine. S medicine, okay? So, you come to me, you have panic disorder, you've been having panic attacks. We're going to make them go away by prescribing you an SSRI. And yes, I can prescribe a benzo for 2 weeks, or I can prescribe something else. We also have other things we can prescribe besides benzos, okay, that will help you. All right, next thing, really, really briefly. I'm going to try to do this really quickly. Agoraphobia is one of the anxiety disorders. That's where you have someone that really cannot go out in public situations. Public transportation, like automobiles, buses, trains, ships, planes. This is on page 217, by the way, in the DSM. Being in open spaces like parking lots, marketplaces, bridges, and things like that. Bridges. Oh, bridges. Oh, bridges. That goes into phobias. We're not going to do phobias today, but anybody who knows me knows that me and bridges, I don't know, guys. Me and bridges, it's like I'm under it, you know, then I'm wondering, like, is it going to smash me? And then I'm on top of it, and then it starts to, like, shake, because bridges can't get themselves together. Bridges, oh, yeah. All right, I digress. Being in enclosed places like shops, theaters, cinemas, standing in line or being in a crowd, or being outside of the home alone. If you all can't tolerate that and your anxiety gets really, really bad, go see somebody, because you may have agoraphobia, okay? Last one I'm talking about today, last one of the anxiety disorders, happens to be on page 222. I'll save OCD for a totally different time because of the time, but generalized anxiety disorder. This is usually hand in hand with major depressive disorder. Usually someone that is anxious is also depressed, you know, because that one chemical, serotonin, if it's really low, then you may have signs of depression too. But generalized anxiety disorders on page 222 of the DSM, and basically it says excessive anxiety or worry or apprehensive expectation occurring more days than not for at least 6 months about a number of events or activities such as work or school performance. And it's difficult to control the worry. The anxiety and worry are also associated with 3 or more of the following symptoms: restlessness or feeling keyed up or on edge. Are you keyed up or on edge? I don't want you to be. Are you restless? Difficulty concentrating, or your mind going blank. Blank mind. Does your mind go blank? Oh, mine does sometimes. Difficulty concentrating. Irritability. Who's irritable out there? Now, I'm not talking about ladies right before time of the month. That's something else, okay? We'll get into that. And men, I'm not talking about, just being irritable after work and you just go home and want to kick the cat. I'm not talking about that type of irritability. Irritability out of nowhere. It's just totally different from how you've been feeling. Muscle tension, like here, we get muscle tension right up in here. Ugh. Are you wearing your shoulders for earrings? That's not cool. Muscle tension and sleep disturbance, difficulty falling or staying asleep, or restlessness or unsatisfying sleep. And these symptoms cause a clinically significant distress in your life. And you're seeing, man, like I'm constantly keyed up. I'm worried and I can't stop worrying. I call people with the generalized anxiety disorder our worriers. Okay? But we give you serotonin, in the form of a pill. And you're not taking serotonin. You're actually taking a medication that's stopping the storage of serotonin. But you do have to take that medication every day. All right? And the disturbance is not attributed to drug abuse, the Mollies and Ollies and Roxys and whatever else, because the same thing can happen if you do that. If you take those Mollies and Oxys and Roxys and whatever, you could be keyed up on edge and feel the signs of generalized anxiety disorder. The disturbance is also not better explained by something like hyperthyroidism, or anything else, because some things can happen in the body that causes people to have just this, worry and just feel keyed up and on edge. All right, so we have talked about some of the anxiety disorders minus OCD. I'll save that because I do want to put OCD personality disorder in with OCD. But I've done my makeup. We've talked about anxiety. We've talked about how to treat it with some of the medications. But basically, I just want to let everyone know that it is treatable. Please do not suffer alone with anxiety because you don't have to. It's treatable, guys. And I don't want anybody to have any stigma when it comes to anxiety, okay? Because I'm telling you, I have some stickler patients and they come to me and they say, Jasmine, I'm anxious and I can't work. I can't figure this anxiety thing out. I say, okay, here, let's take this pill. Take it once a day. And they come back a month later and they say, that pill really works. I cannot believe that pill worked like that. And I say, well, another satisfied customer. Okay. So if you all are taking medications like antidepressants for anxiety and you're still having panic attacks or you're still feeling anxious, go back to your provider so they can increase the dose. Don't be afraid of increasing doses of medication because it's there to help you. And if you need an increase, that means your body got used to it, so, and started to tolerate it some. So it was wonderful doing the second installment of Mental Health and Makeup. And I am your host, Jasmine Young. I'm a psychiatric and mental health nurse practitioner. I'll see you all back here again next time when we talk about, I don't know, but I'll see you all next time.